Live. This is South Florida Today on NBC6 HD.
Okay, well, hair loss is not an easy topic for men to discuss. Some turn to pills to help stop the process, but do the side effects outweigh the benefits? Dr. Alan Bauman is here to tell us about a new study that's just been released. This study getting a lot of attention, but it kind of contradicts a lot of the stuff that we already knew. So why is this gaining so much attention?
Well, first of all, thanks for having me on.
No problem.
We're getting a lot of questions about this study because this is not what we have experienced over the years with Propecia. Propecia is not a new treatment. We've been using it for 15 years or more in some cases to stop the progression of hair loss.
And you were telling me it's the primary treatment.
Yeah, Propecia is the one that works. It's a prescription pill, works 90% of the time. So the issue of persistent side effects is on everybody's mind because of the clinical study that was just published and just came out. Okay, and the clinical study didn't exactly say anything new, but its figures were very skewed. It said that it can cause sexual side effects in 25% of men. That's very high. An extremely high number that they found in this particular study, and they said that the side effects were persistent, which flies in the face of what we know as hair restoration physicians. Like I said, for well over a decade, we've got thousands of patients that we've prescribed this medication to. We know that side effects can happen, but it's rare, less than 2%. Yeah, I was going to say the Propecia website itself says 2% based on the studies that they've done. And that matches what we see in the practice at Bauman Medical Group. You know, if you have a side effect, you go off the medication, and this medication's out of your system in a week, and the side effects are gone. And I really want to point out to people at home as well that this study that was done, the one that we're talking about getting a lot of buzz right now that we don't necessarily agree with, there are kind of some holes in people's backgrounds. It's not the full picture. Yeah. This study was not done by hair restoration physicians. It was done by a group that acquired some of these patients through internet websites and anonymous message boards. They interviewed the patients by phone, sometimes on Skype. They didn't do any blood work. I mean, there's a lot of issues, and they're relying on the patients to tell them what kind of sexual functioning they had prior to taking Propecia. So recall and selection bias is a big problem with this study. Okay, now I do want to get to some of these things that you brought with you today, because you say Propecia, one of the biggest things that you do use to treat it, but there are some other options. So what are we looking at here? Well, when you visit a hair restoration physician, what we prescribe after we've diagnosed the problem is a multi-therapy approach. So for men, Propecia is the #1 treatment. For women, Minoxidil, which is a topical. We've got Compounded 82M, which is a high-octane version of Minoxidil, better than Rogaine, than what you get over the counter. And if you want a no side effect, non-chemical treatment, then you're going to use laser therapy. Okay. And this sounds a little intimidating. Well, laser therapy with low-level laser doesn't cut or burn. Okay. It's a no side effect treatment that you apply to the scalp 30 minutes every other day, and the best way to get it is with the LaserCap. Okay. So this is a device. Can we see what it looks like? Sure. This is a device that you would use at home. Oh, it's just underneath. In the hat. Yes. Oh, I thought the hat was hiding it. Take a look at that. This has over 224 laser diodes, and patients can use this at home, and we track their results through the office through clinical visits. Is it just a warming sensation when they're using it? You might feel a little bit of warmth because it is a circuit board, but the light energy doesn't produce any heat. Okay. So you don't want to look at it, but it is bright. Oh. Because it is bright, but it can't hurt you. Okay. And it's. Are my fingers growing hair right now? Well, I don't know. Do you have hair follicles there? Don't think so. But yeah, the point is that the non-invasive treatments like these work where you have thinning hair, where the follicles are still alive. Okay. If the follicles are dead and gone, you're going to need transplantation. Okay. And the good news about today's transplants, they are less invasive, a lot less painful, and they heal very quickly with no scalpel, no stitches, and no linear scar. Okay, and probably a question on some of the minds at home as well. Where do you go for good information? I mean, the study comes out, you know, gets attention, but it might not be the best. So where can you turn? If you've got thinning hair out there, man or woman, you've got to find one of the 100 board-certified hair restoration physicians that are in the world. Okay. I'm one of 50 who's recommended by the American Hair Loss Association. Okay. So Bauman Medical Group, we've been in Boca Raton for over 13 years. We treat about 1,000 new patients each year with medical management. Okay. That means we help prescribe treatments that get results to stop the progression of the loss and restore the hair that's been lost. Okay. All right. Well, Dr. Bauman, if you want to see him yourself, he has more information about hair restoration. You can visit him. He's located, like he said, in Boca Raton. You can visit more and learn more, at his website, BAUMAN medical.com. Doctor, thanks for being here today. Thanks, Sherry. Yeah.